Let's start our lip filling. We started by doing the round with a needle. Or with the pertuito ready, we are going to start our filling. The pertuito we will always do in the middle of the lip, inferior, for us to have access. Next to, left and right side. We started penetrating with our. This size is 22G. But we might as well be using the 25G. I like more than 22G. We enter there on one side. We inject 0.2 ml of hyaluronic acid. We remove de. We clean, we organize, and then we do all the massage on that side. To get everything right. After that, we will do the same thing on the second side. Let's start filling. Now on the right side. We made the pertuito. Let's go in with the cannula on a plane where we can see. A cannula. And then we will apply the same amount on the other side. Isto é, 0.2 ml of hyaluronic acid. In this case, we are using a hyaluronic acid brand Renew Lifting. That is not a brand. Very fluid, right? It is not a very fluid hyaluronic acid. And not too heavy. Dense. I don't like using fluid because it turns out that the patient does not see the result because much. It is more fluid, so it doesn't volumize the lip too much. Applying 0.2 on the lip there. We will massage. Clean and watch how our lower lip. Massage a little more. We can observe that our upper lip. One side is bigger than the other, so we're testing. Then, now the anesthesia is well maintained. And the side that is smaller, we are going to apply a little more hyaluronic acid. Isto é, 0.3 ml. And the other side, we're also going to apply a little. Only it's much less. 0.1 ml worth. For us to try to compensate, let's do the tagging. Draw Cupid bow well, because that side of the lip is fine. Well damaged, right? Losci. Cupid's bow is practically gone. We made the pertuito. And then, let's apply our hyaluronic acid on the right side of the upper lip. To disinfect the skin there. Before performing, filling. I really like making a product handling that is chlorhexidine 4% more. Blusa Josevani. We send it to a manipulation pharmacy. And here comes the product all together for us to do the disinfection in a way like this. Very accurate. We can get with our in a very clean field. Let's go in now with the cannula. We slide and inject. Let's go up on the plane to make our Cupid bow. Now. With the filling of the upper lip, we can see a lot of improvement on these barcode lines that patients greatly forget. Let's observe. We are going to inject inside what we keep this way, which is 0.13 mils. Let's slide thee on a not very deep plane. And also not very superficial. We didn't get there with the at the end of the lip. We leave a few millimeters,
a region,
so we don't get there on the corner of the lip. And then we go back injecting our product again. Let's massage. Massage one more. See how we have already achieved an improvement. Size. On both sides they look alike, right? Now, from another profile angle, for you to see the back injection of the... It's the same side yet. This patient has many wrinkles around the lip. We have also treated with collagen biostimulator. Skin buster. Let's massage. Look how beautiful our lip is getting. Let's take a test. The patient is feeling a little. That doesn't bother the lips so much. Then we will anesthetize the lip a little more.
Female superior.
To make the procedure very comfortable. We choose to always use lidocaine to percent and not Archie because art is a very strong anesthetic.
So we go to
lidocaine. What is legal anesthesia?
And the patient is not so anesthetized all the time. For many hours.
Very important after performing the lip filling. Ask for photo per patient. So the next day, you need to accompany the patient. Ask for a photo I do not understand.
Ifeni, purpli.
Sometimes it is normal because of the needle. Now what you can't have is a schematic tinge. Is the patient feels a lot of pain. This is not normal. So we need to monitor our patients because if you give an infection, some onset of necrosis, we are already able to intervene before it gets a lot more serious. So we made the pertuito there. Now on the left side, let's enter with our and fill the lips in this region. This side we left only 0.1 ml of hyaluronic acid just to give a glow on that side. Because both sides are already pretty cool, the size compared to before her, that I will leave here later, in the video image. Let's go backwards. Look, we can see how the lip is getting. Wonderful. We will do. A vial with a needle, always remembering to get the air out of the needle. We will always inject a needle into a plane where we get a part on the right side and another part on the left side where we can see the color of our needle. So it's a very shallow lighting technique. We will vacuum to make sure we're not getting any pots. Then yes, challenge to inject.
For us to create one contour on this lower lip
and one eversion too. Let's massage. And in the same way, we are going to do it on the upper side. To draw the Cupid's bow very straight. A little further out of the red line. Actually, this angle is between the red line and the white lip line. We can see the color of our needle, so it's pretty shallow. And we go back injecting. Again. And this is our technique. For this lip filling, we used a technique that uses a needle that I like to work a lot. There, if you have any questions about lip filling, leave it here in the comments that I will answer you. Oh, or follow me there on Instagram. Every day, I give tips on facial harmonization, about Buster Skin, collagen, biostimulators, Botox, so it's really cool there to have more knowledge. Just one moment, and we gonna take the final result. We gonna clean, and we gonna clean, and we have an before and after.